Alexandra. I will share my screen first. You can see me, you can hear me, right? Okay. And can you see my full screen right now?
Okay. Yes, we can.
Okay, thank you. Thank you again, Alexandra. Thank you, the WHO, UNICEF, ISSA, for bringing this together. Mr. Cekic, it was wonderful to listen to your talk, and we are so delighted that a minister, one minister at least, is saying these words and is embracing this initiative. So, health systems for early childhood development. I wanted to share with you why we need this, and what is it we are going to be doing. So why has healthcare systems lagged behind in early childhood development, and they have gone forward in child health? As it was pointed out in the opening, we have brought down mortality. It's not as if this is a new thing. It is quite old. In fact, it is a millennium old, this concept of supporting early childhood development in healthcare. And in the past 20 years, Lancet has brought out 3 series highlighting the importance of this. There is a Nobel Prize winner on this. Heckman's research has been out there for many, many years. We know that it is, if we invest in this, we only gain. And there is a cost of inaction. Now that is being talked about. Acton has an amazing tool where countries can, in fact, calculate their cost of inaction, of not doing this, of not bringing early childhood development focus. The WHO has done tremendous work on this for many years. And 4 years ago, they brought the Nurturing Care Framework, which can help us, which can give us the content of what we are supposed to do. And this is the WHO. This is an institution, a worldwide institution that knows about healthcare systems. So it's not as if we don't know how to do this. And the other thing which was pointed out in the opening by Dr. Kluge was that there are touch points in the health system. Healthcare providers are probably the only, globally the only professionals who reach families at multiple points and are trusted. So why is this lagged behind then, if we know all this? One of the reasons is that we have been misguided by the mortality argument, that mortality is so high that we don't have time to address early childhood development. And yet this is a misguiding because of the fact that childhood mortality and development go together. So any program that's going to highlight early childhood development is going to also be addressing mortality. The importance of the child will be emphasized, and how to get the child to develop is also how to get the child to live. So this is extremely important, I think. Another reason has been that we have been misguided by screening. So yes, programs for, as Dr. Cekic highlighted, there have to be programs for screening, but these are for early detection of problems that are there and don't happen later, right? So for example, like phenylketonuria, but monitoring child development is the way to go. Monitoring and supporting is the way to go for child development, not to screen at cross-sectional time points. So those are global misguided issues. But in our region, and probably specific to our region, we are also misguided by non-evidence-based treatments and polypharmacy. And this, I would like to thank Dr. Martin Weber for leading us into this study of how prevalent this is and what are the issues. There are many therapies in our region being used: massage therapy, Pavlovian behavioral techniques, and only those, hyperbaric oxygen kind of techniques. And then there is huge polypharmacy. Even today, there are millions, perhaps, of children receiving drugs for development, which are actually not even licensed to be used for children, let alone for any problem. So how can we turn this around? I think this effort was needed. It's not like another launch. It's not like another website. It's not like another group coming together. I think it will be a very definitive group to help us go back into theory. So in Leonardo da Vinci's famous words, "He who loves practice without theory is like a sailor who boards a ship without a rudder and compass and never knows where he may cast." So I think that we have lost the theory of child development, and we have in pockets tried to do things about child development, but the theory has been lost. So if we revisit theory, we know that the child does not develop alone, and you cannot just look at the child to address development. You have to do it within the context of the family and the community, and you have to be in relationship with it. So health services, which come closest to this, constellation, need to be partners with this family-child system. And so I call this, the American Academy of Pediatrics and the CDC have the slogan, learn the signs, act early. I think that this is another misguiding for us. It is not learn the signs, because you cannot just look at children. So what we are calling it is revisit theory and add ECD. So are there frameworks for doing this? Yes, the nurturing care framework, the pocketbook, which has been talked about, that the WHO, the regional office of the WHO has brought forth. This is there, and everything I'm talking about actually is there. There are programs. We have a program of ADCD, which includes the Guide for Monitoring Child Development. In Italy, there is the Village to Grow Together. There are multiple programs in our region which are based on the things that I'm going to be talking about. So, but what is, simply said, what are the questions that we should be asking ourselves to see if we are doing this the right way, and the theory-based way, the right way being the theory-based and the evidence-based way? So we've come up with 10 questions that each healthcare provider and healthcare systems policymakers can ask themselves about whether they're on the right track. So, do I inform families about the importance of early brain development? Do I ask families if they have concerns about child development once I've told them what this is? Do I learn about the nurturing care environment that is already being promoted in the home, so that I'm not repeating what they're already doing, and I am not wasting time if the family's doing a great job, but reinforcing their strengths? Do I learn about health-related and psychosocial risk factors that will impede development, and also about how families cope, their strengths and their resources in the communities? The photos I have here are to show you that the answer can be yes, that this can be done in the region. They are a group of photos that pertain to our work in the region, in Turkey, in Azerbaijan, in Kyrgyzstan, in Turkmenistan. So this can be done. All these questions can have a yes, I'm doing this kind of answer. So I'll continue. Do I use theory and evidence-based, culturally appropriate tools to monitor development, to identify difficulties and the need for support? Is my assessment meaningful, not just a score or a delay, not delay kind of an answer? Do I inform families about their own child's development, or are these just very general? And how they might use activities, participation in life and in nature to help their children develop. If the child needs extra support, can I formulate reasons, provide individualized support, and close monitoring? Do I learn about the strengths of children and families? And can I empower families by mirroring their strengths? Do I educate families about neurodiversity and help them address stigma? Can I guide families to appropriate, accessible, evidence-based, family-centered services in my country? Can I help these kinds of services come to front and be chosen? Now, as far as policymakers, I think here are the two questions that are key, or three questions. Is every health provider that I have in my system trained to say yes to all of these questions? Does healthcare system enable providers to put theory into action? Because if you don't give them time, even if they know all this, they're not going to be able to put it into action. Am I giving them funds? So there are reimbursement systems in some of our health systems. Are these being done on their own time, or am I in fact supporting this? Does advocacy enable progress, follow the science, listen to children, families, and service providers and other similar countries? So the South-to-South collaboration, even in this region, I think is extremely important. Now, you may think, I listen to myself and sometimes, what a dreamer, right? Is every health provider ever going to say yes to these? And I do think that they are, because I've seen it happen. And I've seen it happen in many countries. We teach health providers, here on the left, the skeleton symbolizes anatomy. We teach them tons of anatomy that they're not going to use. We teach them to look at the microscope, even identify cancer and this and that, and they don't even see a microscope in their lives. We teach them to listen to the heart and the lungs, and of course we should, but rarely do they use that in primary health care. Yes, in some instances, of course, these need to be taught. But can we not teach them the simple science of early childhood development? I don't believe that there is a reason we cannot teach them that. It has to be in the pre-service education system, and it has to be in service. And they can learn it. It's sometimes too easy for them to learn. And sometimes I wonder if this is also a misguidance, that it's so easy. So I will just end. I do think I have time. So I'll end with a video. And this is a video of how this can be done, that it is doable. This is a little boy with Down syndrome, diagnosed with leukemia on top of the Down syndrome at 2 years of age, hospitalized for 6 months. No services were available. There was just his bed, his mother and his father, which you will see in the video. His doctors and nurses knew about child development. All they said to this family is early brain development is important. We can't wait to treat his cancer, then support development. It has to happen together. Supporting development is in your hands. Let's see how the father and the mother are doing this in a hospital bed.
Göz yapalım mı dedi 2 tane? Burun yapalım. Burun orada. Ağız yapalım bir tane. İçine dişler koyalım. Mete'nin dişleri nerede dişleri? Evet, o dedi. Ayakları nerede ayakları Mete'nin? Orada. Ayakları kokuyor mu? Öf mü? Bakayım böyle.
Peter smelling.
Mete de koklasın. Nasıl kokuyor Mete ayakları? Öf.
Uçak uçuyor. Evet. Aferin sana. Peki kelebek nasıl uçuyor?
Sarı limon nerede? Nerede sarı limon? Evet.
Ay, Mete'nin kalbi geçiyor.
Thank you so much for this opportunity of sharing in this wonderful launch, and I wish you all the success. Thank you.